Okay, we have quite good number right now. It's almost 60 plus. It's 65 to be specific. So maybe 30 more seconds and then we can give it a start.
Hello, everyone. Can you hear me?
Yes, we can hear you.
I apologize. Of course, my computer decided to update itself from nowhere. I apologize for the delay. So I understood we're gonna give a few extra seconds, so to wait for more people to join.
While we are waiting, is it possible while we are waiting that we rename ourselves?
Great idea. I'm doing it right now. Okay, we have a total of 75. I'm happy to start if you all are happy to. I want to start by welcoming everyone to this webinar. It is a jointly organized webinar by the Asian Pacific Gender and Humanitarian Action, known as GIHA Working Group, and the Gender Stakeholder Group. This webinar will address gender dynamics and disaster risk reduction and how anticipatory action is critical in ensuring that preparedness and response efforts are inclusive and effective. So today's discussion will also provide an opportunity to everyone here to share insights, challenges, and best practice in advancing gender responsive approaches across the region, Asia Pacific. This just will be towards the end. This 90 minutes workshop will focus on exploring tools, resources, and discussions on the gender responsive anticipatory action and advancing the Sendai Gender Action GAP. For those who were not here in the initial seconds, if you can kindly rename yourself, putting at least your first name and the organization, just to facilitate for us moderators addressing you if you have a question, so on and so forth. A great reminder that this is one out of these gender stakeholder and we're already taking the opportunity to invite you all for the next ones that will happen throughout the year with different topics. As I said, we're going to be here for an hour and a half. We're going to be quite respectful of your time. And therefore, I'll be moderating everyone who's talking and kindly asking you to speed up if needed, just so we can hear from as many people as possible and we can keep with the time as well. During these 90 minutes, we're going to be hearing from the speakers findings from a regional study on anticipatory action and tools and resources from countries such as Nepal and Sri Lanka. And following these presentations, there will be, towards the end, an open discussion to explore and hear from you, to explore these topics further and hear from you all. So to start off, we're gonna welcome Madhavi. who is going to conduct us with the opening remarks. Madhavi is part of the steering committee of Duryog Nivaran organization and the it's a gender stakeholder group focal point. Over to you, Madhavi.
Okay, thank you very much. Can you hear me?
Yes, we can, loud and clear.
Okay, good. Right, thank you so much. Okay, Gender Stakeholder Group is so pleased to jointly organize this webinar, the first of the series. Let me first introduce what the Gender Stakeholder Group is. Gender Stakeholder Group was constituted in 2012 as one of the 10 stakeholder groups of the UN DRR Asia Pacific Regional Platform. So this we were working as a group before the Sendai framework for disaster risk reduction was approved in 2015. And one of the main tasks of the stakeholder group was to actually provide the necessary information background for formulating the gender and social inclusion aspects in the Sendai framework for DRR. So since then, the main objective of the stakeholder group remains to promote and support gender responsive disaster risk reduction actions in realizing the targets of the Sendai framework for disaster risk reduction. So who is in the group? Well, it's an open group. As of now, who are committed to and who are working to support gender responsive disaster risk reduction. Currently, Gender Asia Network for Disaster Mitigation, and Duryog Nivaran is a research and training advocacy network committed to promoting disaster risk reduction at the policy and community level with specific emphasis on inclusion. And a few words about this webinar series. So Gender Stakeholder Group, as mentioned, is planning to organize a series of webinars focusing on supporting the implementation of the new added support document, the Gender Action Plan of the Sendai Framework for Disaster Risk Reduction. So there are 9 key objectives and related recommendations. And the webinar series aim to share the already available tested tools, resources, ideas for successfully implementing the Gender Action Plan. So I would also like to take a minute to acknowledge who have supported, many of you who have supported the group over the years, and particularly this webinar series. So this was initiated at the Asia Pacific Ministerial Conference for DRR last October 2024. The idea originated at the help desk that the Gender Stakeholder Group organized at the conference. And the groups, organizations, individuals who gathered around the help desk actually showed us there are very many tools and resources which can be helpful to be shared among everybody who is working on the subject. And the project, there's this project SIDRA, supported by the Swedish International Development Cooperation Agency, Disaster Risk Governance. Is the theme of the project, and this project is led by the International Refugee Council, Asia Disaster Reduction Network, and Duryog Nivaran. And so one of the primary focus areas of this risk governance project is also gender and social inclusion. And the rest of you who are joining this webinar, you have been advocates and active participants in this journey of gender and inclusion. And we look forward to working with everyone here to ensure that Sendai Gender Action Plan is actionable through mutually supporting one another, sharing views, experiences, and resources. So if any one of you interested in getting on the Gender Stakeholder Group mailing list, please do drop us a mail. And thank you so much. I look forward to listening to the interesting presentations on anticipatory action and the discussion afterwards. Thank you so much.
Excellent. By the way, if you can kindly put the maybe the email address on the chat so people interested in join can forward you guys a
Yes.
message, I think would be appreciated.
I'll do that.
Let me
Yeah.
briefly talk about Giha, who is the other stakeholder helping in the facilitation of this workshop. So we are the regional Giha working group. We've been working a comprehensive approach to ensure that gender equality in humanitarian settings. This regional group is deeply committed to integrating a gender perspective across all sectors of the humanitarian response and preparedness, because we understand the amplified needs and vulnerabilities of different genders during crisis. So women, transgenders, girls, and men, they are not affected in the same way when a disaster happens. So the approach needs to be tailored to their needs, right? So we're committed in supporting the international policies and practice, and including those from the Interagency Standing Committee. Okay, we have if you are interested, you can join as well our quarterly meetings and understand a little bit more what we're doing at the regional level and how we can support your organization or the country you're working with. Okay. Look, unfortunately, the next speaker, she won't be able to be with us in person, but she kindly recorded a video that would be her 10 minutes presentation during this webinar. So Bronwyn, we're gonna hear from her. She is the United Nations Disaster Risks Reduction Gender Focal Point. And she's gonna give us a concise overview of the Sendai GAP and how anticipatory action is prioritized in the GAP, Gender Action Plan. And we have the video. Can you guys see it? The screen. We can't hear, but we can see Bronwyn. So maybe there is an option, I don't know who is sharing, but that you can share audio as well. So maybe stop sharing and then just mark this share audio as well. Yeah. Nice. No, we can't. I can't hear. I don't know if others can hear.
No, we can't hear either.
No, right? Look, at this stage, we can try to troubleshoot, and then we would, I'm happy to change the order of things. Aisha or Rita, what do you guys think? Maybe we go to Sumaya and then we try to go to the video.
Yeah, we can do that.
Okay, so let's just invert. I don't think it's gonna affect the results. And then it gives another 10, 15 minutes for us to troubleshoot in regards to the video. Let's move on to hear the findings of the study on the original anticipatory action. And we're gonna hear from Sumaya. She's a AA expert and currently working with UN Women. Welcome, Sumaya, and please, the online floor is yours.
Thanks so much. I hope you can hear me.
Yes, we can. Not loud, but clear.
I'm not sure how to fix it from my end.
No, it's good. It's good.
Cool.
You go. You're fine.
I have a presentation to share, so I'm just going to share my screen. Please bear with me. And here we are. I think. Technical issues. Let me try one more time. Sorry.
right.
You can't multitask, so you just have to wait.
You can, you're a woman, come on. Okay, I think, yeah, we can see if you go on presentation mode. Let's see.
Yeah, there you go.
Perfect.
So thank you for giving me this opportunity to present a study which was commissioned by UN Women's Regional Office. But this was jointly done with the GIHA Working Group and the Anticipatory Action Technical Working Group at the regional level. So I know I just have 10 minutes, but I'll try to speed through some of the key highlights from this assessment. So we were trying to, through this study, look at how the different anticipatory action approaches being implemented across the region are incorporating gender equality, social inclusion into the approach. So just to start, I wanted to share the definition of anticipatory action, which a lot of you know, but essentially, I thought it was important to set the scene here, which is, as you know, anticipatory action is a set of actions that are taken before the disaster, impacts of the disaster can be felt, before they truly unfold by definition. This is a G7 definition. But essentially, for us to be able to take anticipatory actions in very limited time frame, in a lot of cases, it's just 6 hours. But in some cases, for example, in Bangladesh, for riverine floods, they have a lead time of 5 days where you have probability of around 80% the flood will happen. For a longer lead time, about 15 days, you have approximately 40 to 50% that the flood will happen. So that's kind of the frame in which we work. So you're talking about sometimes a few days to for droughts. It can go up to a month, 2 months. But essentially, it's a very limited amount of time for us to be able to implement anticipatory actions. So this requires us to have agreed plans in place. So this is plans which include very clearly the types of actions which will be taken, your partners, when these actions will be taken, the financing, who you're targeting. So this entire system needs to be set up well in advance. So essentially, as soon as you get the early warning, you're implementing your actions, no questions, no time for thinking, you just do it as it is. So it takes on a very no regret approach. So essentially, what's very important for anticipatory action plans or protocols is the trigger. It's this point where we agree that we will take the action, no regrets. So this is done in discussion with a lot of different partners and stakeholders which are involved in the anticipatory action protocols. Now, it is still in the early stages of this innovative approach. What I mean by early stages is it's still in a very project-based approach. So these are very specific areas that are being targeted by specific actors. And these are largely still funded by humanitarian actors. By this, we mean OCHA's SURF, which is accessed by UN agencies. Some of the bigger UN agencies are WFP, FAO, UNICEF, UNFPA. And then we have DREF, which is the Red Cross's internal funds, which also has anticipatory action window where you have funds that can be accessed if you have protocols in place. And similarly for NGOs, you have the START Network's anticipatory action window as well. But anyway, for Asia Pacific in particular, we tend to take a bit more of a systems-based approach. So we're looking at having systems in place. So early warning systems, disaster management systems, social protection systems. We're looking at also agriculture. So different agencies, different organizations have taken different focuses according to their mandates. The ASEAN Secretariat has recently published an AA framework, which talks about 3 key building blocks. So it's the risk information forecasting early warning, which is a key part of anticipatory action systems. You also have the planning, the design, the operations part, the implementation part of it. And then, of course, the financing, which is quite critical to have it, as I said, arranged from beforehand. For the purpose of the study, we've gone further into dividing the financing into the policy and institutional side, because largely a lot of the national policies in place are very reactive in nature. Actions are being implemented in response to disasters. So there needs to be changes in the policies, or anticipatory action needs to be integrated into our policies for us to be able to act early. Monitoring and evaluation is another key component of this entire system, which we're trying to look at. So for GESI, it's a whole other approach, but we're looking at it more in a very integrated approach. How do we bring this into anticipatory action? So for this study, we're looking at having gender equality, social inclusion. So identification of the different groups, different vulnerable groups. So it's not only the gender groups, but also the groups that are more vulnerable. So people that are poor, you have persons with disability, you have elderly, and also ethnic minorities, depending on what the specific context is. So we're analyzing their needs and their barriers. So another important criteria is also looking at the systematic integration of GESI into all of these different components of the AA system. And then eventually, the access to the results. So access of these different groups to anticipatory actions which are being implemented. So according to the Anticipatory Action Technical Working Group, we have anticipatory action being implemented across the region in 13 countries as of last year. There are many different protocols. We have very different disasters as well, ranging from floods to droughts to heat waves as well, and also typhoons. Some of the examples in the region, just to give you an idea of what types of actions are being taken place. FAO in 2017 implemented anticipatory actions focusing on farmers with animals that were impacted in the Zud. This is a spell when there is a lot of cold weather, dried conditions. So animals it's very difficult for animals to survive this cold spell, the Zud. So FAO partnered with the Ministry of Agriculture, and they bought a lot of these animals from poor farmers, destocked them, and gave the meat back to the households which are living in poverty or classified as vulnerable. So this has proved, according to evaluations conducted, there's been around $32 worth of savings. Some other anticipatory actions that are being implemented are cash before floods. So WFP in Bangladesh, they distributed cash last year to approximately, I think, over 50,000 households. Households were able to buy necessary food, medicines, and other items which they needed. Another important part of a lot of the anticipatory action protocols is the dissemination of early warning messages as well. So overall, what we're seeing is gender equality, social inclusion comes in specific, anticipatory actions which are being taken. For example, UNFPA is distributing dignity kits to women in vulnerable locations in flood-prone regions or disaster-prone regions. There is also specific targeting of households, for example, cash, which goes to households with pregnant lactating women, with households with multiple vulnerabilities, people with disabilities, children, elderly, in poor households which are in vulnerable locations. There are some protocols which are informed by gender analysis, although this is not systematically done. And there is a participation of different groups or representatives at the local levels, in particular, when local government units are developing anticipatory action plans according to protocols that are existing. Now, how do we enhance GESI across the AA building blocks? There's a lot of opportunities which are coming through in the discussions. One specifically is in having more localized triggers. Triggers which are specific to vulnerable locations, and also potentially inclusion triggers. So earlier actions which can be taken specifically targeting households which need a bit more time, for example, to evacuate, or could use the cash in order to take preparations before floods occur or before the typhoon occurs. There is also opportunity in having more impact-based triggers. So triggers which are developed based on risks as opposed to the science of the hazard. But so this allows us to bring in a little bit more of the risk information, of the vulnerability information. But what we are seeing, what we really need over here is more data on the vulnerabilities, and also interpretation of this data to develop our plans and actions. For example, if we are talking about persons with disabilities in certain areas, then what sorts of actions should we design for us to be able to meaningfully reach them with actions which they need and at a certain time that they need. So there are, of course, certain challenges which requires us to have more coordination, streamlining of data and information. And also another important part in this building block is making sure that communities have access to timely early warning information, which is not necessarily the case in a lot of the areas. Of course, we've made a lot of developments in terms of access to early warning information, but this needs to be more localized, and it needs to be interpreted or connected with anticipatory actions which need to be taken. So communities are basically able to take actions according to the information that they're getting. There's also a lot of gaps in access of persons with disabilities to early warning information. So this is also an area which has been identified as more needs going forward. In the design and the planning, there is still more need for representatives or civil society organizations, women-led groups to be involved in the design and the planning of the anticipatory action plans in particular, and looking deeper into each of the sectors. So if we're designing food security and nutrition anticipatory actions, what are the GESI aspects that we need to be looking at? What specifically, how do we design specific packages for these groups. So this is also an area which needs further unpacking. One thing that is coming up really strong is basically the keenness of communities, or there's been a lot of positive response in anticipatory cash because it allows a lot of the households to decide on how to use this cash. Different households have different needs. So for example, some of the households in Philippines, which we were speaking to, were able to buy medicines, which are not necessarily included in food packages or anything. So cash is actually a lot more dignified approach, and it allows women, it allows specific people in the households to get the needs that they have before a disaster. In terms of financing, and I realize that I'm going over time. In terms of financing for anticipatory action, there is a possibility to layer or sequence funds. A lot of the triggers are set at high levels. There are some triggers especially used by NGOs, which are designed for community-based activities. So this needs a little bit more of a prior activation. So at the local levels, we can potentially look at bringing together all of the different types of available funding and sequencing them in a way that different groups, different activities can play out before a disaster occurs. There needs to be percentages that are specifically allocated for GESI actions, GESI-focused actions, specifically for GESI-focused groups, and also access for local government units to financing as well. In terms of policy and coordination, there's a lot of reiteration of the need for embedding GESI into DRR policies, but also embedding GESI and anticipatory action into disaster risk reduction policies and frameworks. It can be in the form of disaster management policies, disaster management plans, and also contingency plans at the local levels, including elements of the protocols which are being developed, for example, the triggers. So we're looking at it in a more holistic way, so all across the disaster management cycle. There are technical working groups established at the national levels. However, a lot of these do not have the women-focused ministries engaged in them. So there is a definite need for women's ministries to be able to work with or to be included into the technical working groups, or have some connections to the GIHA platforms at the national levels as well. Overall, there's a need for...
Yeah, we have to wrap up. Sorry.
No problem.
Another extra minute if you can bring everything together.
Yeah, no, I'm just going to end with the need for the evidence to speak to have GESI indicators included in them. So I end here, but there are some key resources. I think this also connects to the Gender Action Plan, which I think another presenter is supposed to go on. But anyway, I end here. Thanks so much for the time.
Not a problem. Thank you so much. That was quite interesting. I saw colleagues asking if you can kindly share the PPT after the webinar. If you can, please do. We have time to maybe for one question. Or clarifications. Yeah, we have a hands up. It's PCW. Gregory, go ahead, please.
Hello, good day to everyone. I am Gregory Lois Magbanwa from the Philippine Commission on Women. So before I would like to ask a question to our resource person, just wanted to share that of course, in the context of the Philippines, gender responsive anticipatory action integrates gender considerations into disaster preparedness and early action to mitigate the impact of climate-related and natural hazards. So it ensures that anticipatory intervention address the specific needs, vulnerabilities, and capacities of women, including men and marginalized groups before disasters strike. So, given that the Philippines has limited funding for gender-specific interventions, specifically more on the cultural barriers to women's participation and gaps in gender disaggregated data, how does GRA address gender-based violence during disasters? Maybe you can share, Ms. Sumaya from UN Women. Thank you.
Over to you, Sumaya. A brief answer, sorry.
No, I think there's an opportunity to bring in a lot of the gender-based violence tools that are available for a lot of the DRR programs into anticipatory action. What we need, though, is to have the prior discussions with, especially in the communities that we are working, the individuals or the households or the representatives of the groups that will be that are likely to be impacted or vulnerable to gender-based violence in disasters. So it really starts with the identification of who these vulnerable groups are, and then also designing actions with them, together with them. Another thing to note is there's a lot of vulnerabilities faced by groups, especially when they are accessing, for example, cash or packages around distribution points as well. So making sure that protection principles are also included in distribution and access to anticipatory actions. So existing tools, using those for anticipatory action is quite important.
Thank you so much, Ms. Sumaya.
Thank you. Thank you, Gregory. Thank you, Sumaya. We're gonna, Sumaya, if you can stop sharing your screen, please. We're gonna move to try to go through the video again, which is gonna be the overview of the Sendai Gender Action Plan.
My name is Bramlyn Miller and I'm the Gender Advisor for UNDRR. It's a pleasure to make some short remarks today, and I really want to thank the Gender Stakeholder Group of the APDRR and the Gender and Humanitarian Action Working Group for organising this very interesting webinar series. The Gender Action Plan to support implementation of the Sendai Framework for Disaster Risk Reduction, or the Sendai GAP as we call it, because that is certainly a mouthful, was launched at the Commission on the Status of Women in March 2024, last year, about a year ago, following a year-long multi-stakeholder consultation process that I'm sure many of you were engaged with. So thank you for your contributions to the Sendai GAP. For those who aren't aware, the overall goal of the Sendai GAP is to accelerate the achievement of the Sendai framework by substantially increasing resource allocations and activities and impacts of gender-responsive disaster risk reduction, and substantially decreasing gender-related disaster risk by 2030. The Sendai GAP sets out 9 key objectives on different aspects of gender-responsive disaster risk reduction and includes 33 recommended gender equality actions with many practical examples, and these are mainly for use at the national and local levels by governments and other stakeholders. Priority 4 of the Sendai framework is enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation and reconstruction. Another mouthful. This priority of the Sendai framework is all about planning in advance to recover from disasters better. We know that the limited institutionalization of planning for recovery and for reconstruction before disasters strike leads to ad hoc processes that are established following a disaster. On the whole, these tend to replicate past recovery efforts, which we know have not focused on addressing gender equality issues in recovery. So key objectives 7, 8 and 9 of the Sendai GAP aim to fill this gap. Key Objective 7 is specifically focused on implementing gender-responsive and inclusive end-to-end multi-hazard early warning systems and anticipatory action. In our Asia-Pacific region, we have seen the tremendous impact that multi-hazard early warning systems and anticipatory action have had in terms of saving lives and preventing injuries and losses. We've got fantastic case studies of successes across our region. Anticipatory action is really a tool that we can use which sits at the intersection of disaster risk reduction and humanitarian response. It really looks to exploit the window of opportunity between an early warning for an imminent event or for a hazard to occur and that event materializing. But we also know that gender-based and intersectional barriers to shaping, receiving, acting on risk communications can all mean that women and other gender equality and inclusion stakeholders do not benefit equally from such systems. What the key actions under Key Objective 7 of the Sendai GAP aim to do is to ensure greater access for all through gender equitable, protective and inclusive approaches. This requires budget allocations, appropriate communication approaches, monitoring and evaluation systems that look at who is receiving and acting upon early warnings, who is receiving anticipatory action, the benefits from anticipatory action, and the ongoing and resourced engagement of women's organisations and other gender equality and inclusion stakeholders in leadership in the creation and support of these systems. I'm very sorry I can't participate in today's webinar live, but I really look forward to listening to the recording and learning from all of today's tremendous speakers. Thank you again.
That was great.
Yeah. आज तुम्हारा मैं काम ही करके ना मैं इनके खिलाफ एप्लीकेशन आज लॉन्च करती हूँ शुरू
Can
करती हूँ
you mute yourself, everyone? That was quite an insight. Brownie, receive our thank you, whatever you are. Let's move on. We're gonna now talk to Dr. Bisma Kumar. He's the Chief Executive Officer of the National Disaster Risk Reduction and Management Authority in Nepal. And he's going to be talking to us about tools and strategies for inclusive anticipatory action. Hello. Welcome, Dr. Bisma.
Am I audible?
Yes, we can hear you loud and clear.
Okay, let me just upload the document. I'm not sure. Docs. Share document.
You want to share your screen?
I wanted to share. Yeah, I guess you do have my presentation over there, no?
Preeta? Yep.
Please, just, I'm getting some sort of technical problem over here, so.
No problem at all. I think it's, yeah, there you go.
Okay, fine, thank you.
No worries.
Yeah. Basically, thank you very much. Just I'm quite interested to hear all those presentations made by Sumaya as well as the very recent video. I will try to stick to my given time frame. First of all, this guideline, JRC guideline, why it is just missing again? The presentation is again lost.
Yeah, apologies. Maybe while still loading, maybe you could kind of start explaining the tools or strategies that you guys are implementing in Nepal.
Okay, that will be better. The presentation you may share in a later. Okay, let me check my file then.
We always try our best, but you know, technology.
Sometimes it happens.
Yeah.
Committee, internet. Just a second. Modified. See.
There you go. We can see it again.
Yeah, it's on the screen, Dr. Bisma.
Okay, fine. Fine, that I was looking up. Yeah, next slide, please. Sorry for the technical, problem over here. Next slide. Can you just move it? Okay. Yeah, this action plan, strategy action plan on Jersey. We have moved forward from JC to Jersey. Jersey, it was developed very recently, and we presented this action plan during the AP MCDRR in the Philippines. And this document has been supported by the very recent another document, the government standard. It is called the SOC Responsive Social Protection and the Relief Standard 2024. It was formulated in line with the objective of the strategy action plan to make ZC as an integral part of social security system. This standard that includes the various aspects of the strategic action of ZC provides a broader legal framework for the gender responsive anticipatory action also. It focuses on maintaining and using disaggregated data of the vulnerable population for anticipatory action by the local government. For this purpose, even today, that we are holding a preparatory meeting to develop anticipatory action framework for Nepal. Next, please. Next one. Seems it is taking time to move slides. Is it working? Hello?
Yes, it has moved.
Because it.
Yeah.
Okay.
We can see key actions taken.
Yeah, it takes time. Yeah, key actions taken. Localization for bringing their efforts in DRRM to the grassroots for the wider impact. Yeah. This one, with our annual programs of NDRRMA and with the support of our development partners as well as the partner organizations, including NGOs and INGOs, we have started programs for the localization of Jersey action plan at the grassroots level. It means so many activities are being conducted in Palika level. Palika is the lowest, unit of the government in Nepal. And in the meantime, we have also been launching few capacity building activities at the provincial level and the local government level, so that they can incorporate the aspects of Jersey strategy into their provincial as well as local plans. And simultaneously, it has been really difficult to find disaggregated data on vulnerability. That's why we are also working on that. Basically, the mapping of the vulnerable communities, with the geo coordinates, so that we can identify the beneficiaries that should be addressed with the anticipatory action once the triggers of the disaster are unset. And we are collecting the data in our BPAT portal, that is an integrated platform of all those data related to disaster management and early warning system. So We are trying to integrate and maintain the disaggregated data of the vulnerable population that we have to address to. Next, please. Next slide.
It's already on the screen. It takes a while to,
Already
I think, to load for you.
I guess I have to open the slide myself so that I can save time from this end. Internet connection is having a little bit problem with my internet connection. Yeah. Next one, Embark talked to you a little bit earlier. Basically, this is the very recent guideline, the standard that is called SOC, Responsive Social Protection and the Relief Standard, is aligned with our action plan, JERC action plan. And at NDRRMA, we have established one anticipatory action clinic that has been instrumental to expedite the implementation of the action plan, as well as that will be a kind of focal unit to develop the national framework for the for the anticipatory action. So the drafting of anticipatory action framework hopefully will be completing it so that
Oopsie, I think now the connection is entirely gone. Dr. Kumar? I suggest that we wait for another 30 seconds. If he doesn't come back, maybe we're gonna move to Ms. Sarawa, Fernando, and then, can you hear us, Kisma? We can't hear you.
Yeah, having a little bit problem with.
Yeah.
Now should be okay.
Okay.
Now?
Yes, please go ahead.
Yeah. Next one, next slide, please. Unfortunately, my internet connection is so unstable, so having a little bit problem. Am I audible now?
Yes, we can hear you. And slides is issues and challenges.
Okay.
And just be mindful of time, please.
Hello.
Can you hear us?
Should be okay now. No?
Yes, I can hear you. Dr. Bisma, can you hear us? Maybe for the sake of time.
I may jump in if that is okay with you, Marina. Just a suggestion, if Dr. Bisma...
Sorry, I'm
no worries.
having on the network, so hopefully I can complete right now. So there are a couple of challenges. Although we have developed quite fantastic JERC action plan, and simultaneously we are our very recent standard, anticipatory action related standard, It is called SOC, Responsive Social Protection and Relief Standard. It's quite supportive to include the activities mentioned in the Jersey framework. And the next document that we are going to develop, I mean the Anticipatory Action National Framework, will be another supporting document to implement the anticipatory action in a very effective way. However, there are a couple of challenges. For example, still we have to work a lot to fulfill the gap of disaggregated and georeference data. And we should develop capacity at the provincial and the local level that has been not enough at the satisfactory level. And so many people, even including the policymaker, are not well aware of the aspects of anticipatory actions and its JERSI related, various approaches. So how to incorporate such ideas in a regular plan is equally important and equally challenging. And we do have a few opportunities. We have, for example, sharing of good practices and experiences in Jersey across the regional forum and with the lots of exchange programs. We have clearly mentioned the human-centric risk information to communicate effective action. Early warning communication has been targeted to the person with disabilities, addressing with local languages, different languages, using common alert protocol. And we have an opportunity of establishment of Jersey clinic at NDRR MBA, and they're going to integrate Jersey into our anticipated action framework. We are integrating the Jersey consideration in volunteer formation and management systems. So these are a few opportunities. Again, I would like to, apologize for any kind of disturbance due to the unstable network. However, I could cover, though I took a little bit more time due to the, unstable internet. So, in short, I would like to mention that there are lots of opportunities with us, and a few challenges, but we are going to overcome few challenges with the anticipatory action national framework, and once we integrate it with the local and the provincial plan, that will be really helpful to us. Thank you very much.
Thank you, Dr. Kumar. I'm sorry that the connection ended up eating part of your time, but I appreciate you taking the time to be with us, and thank you so much for the presentation. And of course, congratulations on the work. That's the most important part you guys are doing in Nepal. So thank you very much. We're gonna move on to Sarala Fernando. He's a humanitarian project analyst specialized in gender-based violence prevention and response in humanitarian settings. Currently working with UNFPA in Sri Lanka. Welcome, my dear, and the online forum is yours.
Thank you. Let me share my screen. Hi, everyone. I hope you can hear me.
Can hear and see your screen.
Yeah. Hi, my name is Salva Fernando, and I'm the humanitarian project analyst for GPV at UNFPA Sri Lanka. So today I'm here to present on one of the key perspectives on gender responsive anticipatory action. So it's evident that during disasters, women and girls are disproportionately affected, and they are at an increased risk of facing gender-based violence. So it's important to spot these risks very early on in order to prevent them. And that's why GPV safety audits are very important. And in this regard, the UNFPA Sri Lanka introduced a tool called GPV Safety Audit that can identify the GPV risk at evacuation centers and take measures to prevent them. So let me start off by introducing what a GPV Safety Audit is. So GPV Safety Audit is a structured tool to identify risk on GPV at evacuation centers and then find solutions to mitigate them. So essentially, it asks three very important questions. First one is, where in the evacuation center do women and girls feel safe, and where do they feel unsafe? The second question is, what kind of risks are present in these evacuation centers? And the third question is, what can be done to improve safety? So a GBV safety audit can be done both in the anticipatory action phase and also in the GBV response phase. Now let's talk about key components of a GBV safety audit. So a GBV safety audit looks at 4 key areas. The first is the risk assessment. We identify the unsafe locations and the factors that can increase the risk of gender-based violence. Second is community engagement. We listen to women and girls who are affected and also other vulnerable communities like persons with disabilities, pregnant and lactating mothers, elderly persons to understand their concerns. And then third is the service and infrastructure review. So we look at the quality and availability of services that and the infrastructure that are available in the evacuation center. So for example, we can look at water and sanitation facilities, lighting, whether there's security present in the evacuation center, and disability access and so on. And we also look at the services. So we look at whether healthcare professionals are coming to the evacuation center regularly, what kind of services are available, is there information disseminated at the evacuation center on where to go if they need support or services. And in the absence of certain types of services at the evacuation center, it also looks at whether there is a referral mechanism available which people can go for support. And finally, once you do this review, you come up with action-oriented recommendations and you provide practical solutions to reduce this GBV risk. So to do this, we can use multiple tools, and it is recommended that you use more than one tool. So you can use checklists that can look at the key features of an evacuation center. You can use mapping, where you map the evacuation center and the surrounding areas in the evacuation center and mark any area that is unsafe for women and girls. You can use surveys. You can do focus group discussions with the affected women and girls. You can do key informant interviews. And you can also do a site visit and then make observations, because some of these things you might not necessarily need to ask outright, but you can simply observe by doing a site visit. So who conducts a GBV safety audit? A GBV safety audit is not something that one organization can do on their own. It should be a multi-sectoral approach. So ideally, a GBV safety audit team should comprise of government officials, GBV specialists, humanitarian organizations, and very importantly, members of the community themselves who are involved in carrying out a GBV safety audit. And joint GBV safety audits are very important because they can promote increased coordination and can help find creative solutions to mitigate the risk that they identify. So how do we conduct a GBV safety audit? First step is to engage the community. You consult and you listen to the women and girls and vulnerable groups to understand their concerns. And second step is to identify the high-risk locations and the risk areas. Third step is to collect data using the tools that we spoke before. So once you do that, it's also important that everybody who was involved in the GBV safety audit process to sit together for a quick debrief where you clarify your findings, clarify any concerns, and then ensure that all the key risks and gaps are accurately documented. So once you do that, step 5 is to develop recommendations, and step 6 is to advocate and implement those recommendations. So it's important to note that GBV safety audit doesn't have to be a standalone intervention on its own. It can instead also be incorporated into existing assessments that are done by other stakeholders. So for example, in a disaster, there might be other clusters that are operational, like WASH cluster might be doing some of the water and sanitation assessments. And some of these questions on, is there like washrooms that are gender segregated? Do they have lockable doors? Those kind of questions, you can already integrate them into those existing assessments. And that way, GBV risk analysis becomes a part of broader humanitarian programming. And ideally, that should be the ultimate goal, because it shouldn't be, GBV safety audits should be a cross-cutting theme and not a standalone intervention. So finally, I want to talk about why GBV safety audits are a good tool in anticipatory action. Like I told before, GBV safety audits can be done both during the anticipatory action phase and also during the disaster response phase. But it's especially important to do it in anticipatory action phase, because then you know the risk before the disaster occurs itself, that these kind of GBV risks are present in the evacuation centers, and you can take preventive measures to mitigate those risks. So, and we all know prevention is always better than response, and it's more effective. That's it for my presentation. I went quickly, but I'm happy to answer any questions if anyone has. Thank you.
Thank you very much. Thank you. We're gonna take questions just for the sake of time. I'm sorry, I keep reminding everyone. We're gonna take questions in the end. If you guys allow me, we're gonna move to our last speaker. If she's Carol?
Yeah, I'm here. Can you hear me?
Excellent. We can hear, we can see you loud and clear. You are the head of programs and humanitarian lead for Action Aid Australia.
Yes.
Welcome, my dear, and you have the floor. Go ahead.
Thank you very much. And acknowledging all the other presenters before me, learned a lot from them. Today, I just want to talk about the multi-hazard early warning system that is we have tried out, led by women in the Pacific region. And I thought it would be a good opportunity to talk about a multi-hazard early warning system as an anticipatory, a key component of anticipatory action, because for us, that has been a starting point for us to do the anticipatory action, particular in Vanuatu. I also want to acknowledge that today I'm going to talk about a model that we've tried out in Vanuatu called Women, Wet and Weather. And this, I was given the responsibility to lead the starting up of this model in Vanuatu. That has so far been very successful. But recognizing the origin of this model is a Pacific women-led innovation that started through FemLink in Fiji, where they used community radios and networking to promote multi-hazard early warning system. But when it reached Vanuatu, we adapted it to the local situation and therefore have used phone technology as a mechanism to establish it. Now, this system, Women, Wet and Weather, is a local term in Bislama by Vanuatu women, say women watching the weather. And this system is, we started it with very local women, 12 women to begin with. They were trained and they agreed on establishing messages and message bank and how to make these messages short that could be disseminated through a phone tree network and also through bulk SMS system. We realized that we had to work through the women's organizing because there was nothing in place that was put in place for early warning. And by women, by local women, that the local women could do to better prepare themselves. And so this is embedded within a 9,000 women collective known as Women Talk Together, based in 5 islands. And so they are the ones that gave us the confidence and constituency to start this work. And so the work is done through the women. And so the slide you up there is just showcasing how that model works. So we have ActionAid Vanuatu and Vanuatu Young Women for Change as the hub. So the coordinating point, the hub is the one that looks after the messaging and quality assurance, but works through the Vanuatu Meteorological and Geohazard Department, where we get the correct timely information about the weather and any other changes happening. And then this is translated in local language, 160 characters that can be used with phones. And in this instance, most of the network members, who are now approximately about 60 women with handsets, they're called correspondents, can disseminate this information. But before it is disseminated, the information is got through the humanitarian apparatus system. So the National Disaster Management Organization, clusters, and national authority, to make sure that they approve the information and that the information is factual. And so then this is disseminated through a 4,000 women network, which numbers are all embedded in a phone directory system within the structure, and then it trickles down. Now, some people ask us what happens then where women don't have handsets, where they don't have phones, and what happens to men in the community. So where there are no handsets, so Women Talk Together is organized in such a way that all women leaders within their network knows who is who and where they're located. They also know who has phone and who doesn't have phone. And so they will then disseminate, but they know that Sophia doesn't have a handset. So they will walk, their leaders will walk to Sophia, the WIT circle leaders will go to Sophia's house and let Sophia know that this is what the message we've got. Can you start preparing? There's flooding coming, or there's going to be a cyclone, and you've got to be ready. And so then Sophia also has worked on developing a women-led preparedness plan. And on preparedness plan, they have a 10-step plan where they know, I have to make sure there's water. I have to collect all the documentation for my kids and make sure they are stored in a safe box and I can carry it away or keep it somewhere safe. I have to make sure there's enough food that I can carry on for a few days, water, if there's somebody in the house that needs medication, all that is stocked in advance. Now, we call this is women-led preparedness planning. Next, so this system is now recognized by the government and works hand in hand with the government and does not go beyond what the government approves. Now, today, I just wanted to share with you, which I was, the challenge I got, what women's leadership is all about in this and how does it start up? So I called it the starting point. So first of all, when starting this piece of work, the multi-hazard early warning system, we did recognize that our constituency was women, that they were working through collective power, and that's why we work through Women Talk Together. We also recognize that women have their existing organizing and leadership potential, the traditional knowledge that has passed on from generation to generation around climate, and also the scientific evidence that they have gathered through various trainings that they could now apply. Now, this was in an attempt to respond to humanitarian crisis, because after conducting assessments and responding to disasters, the very obvious thing was that women were not well prepared at the time, which was when we started in 2015 at the backdrop of Tropical Cyclone Pam. And then there have been other disasters following that. So we then worked with them to work on this mechanism. And this program, the multi-hazard early warning system, is not, separate from, it is embedded within a broader program that is supporting women to participate in climate and humanitarian action to claim their rights. And one of the rights, they say, is the right to have information and knowledge around climate to be better prepared. Next slide. We also then said, we cannot do it on our own. Quality and facts are very important things to saving lives. And therefore, we established partnerships with climate services. So the Ministry of Climate Change National Action Board on Climate, but also the Vanuatu Meteorological and Geohazard Department, who monitor the weather and give real-time information on what is happening. We then also established a technology partnership, and in this instance, we worked with Digicel because they had prior experience on sharing bulk SMS, but they could also give us immediate information on the reach, how many people have we reached through the bulk SMS. So with Digicel, we have a partnership agreement where it is articulated how we pay for data, a subsidized rate for data. We buy handsets that are compatible, but also getting that information. We also collect information with the women. So it's the women themselves, local women who we refer to as correspondents, who disseminate this information, but also there's a feedback loop. They also share back feedback. Oh, there's flooding, a bridge has gotten broken here. Children, there's a disease outbreak because of the cyclone, this and this and this. And this is remitted back to the humanitarian system or the healthcare unit or wherever that can take action. But to do this, we also invested in,
So sorry, just be quite mindful of time. If we can,
just nearly getting there. So we also conducted trainings for them. And it was very emotional to see them, holding phones and typing. And some of them were very emotional, saying, since I left school, I have never written, I've never typed. That's the time we knew that most of those women actually understood English. But they never speak it because they had no reason or whoever to speak with. But recognizing that Bishlama is their core language that they talk through. We also established the hub, which is the coordinating point, which is managed by ActionAid Vanuatu, to ensure that things are according to the national policies and we are not, doing things that are out of line. And then we also recognize it's important to give this feedback that we are getting and listen to the humanitarian architecture and hearing and also building partnerships within that system, e.g. the cluster system, on how we could support. Next slide. I think these are the main talking points I had. I just wanted to show you the faces of the beautiful women who've started this platform. I have great respect for them because more often people don't think that women, local women, can do this type of thing, and they, it's mainly for the elite. Next slide. We've also done a study in partnership with the University of Technology, UTS. It's called the Economics of Acting Early. And this study is quite interesting because proves that because of this multi-hazard early warning system, there's savings that take place and that people cannot, the women in the communities actually are in a better place. And it's good to read it. I just want to share that, because of this system during the recent cyclones, we realized that the women were not panicky. They were better prepared than before. I'll end my presentation there. Thank you very much.
Thank you very much. And indeed, beautiful women. Thank you so much for sharing your presentation, Carol. Appreciate it. Colleagues, as we are going towards the end, we still have 10 minutes. Let me open up the Q&A session by inviting the Sri Lanka Disaster Management Center Director, Mr. Shatura. Are you with us? Yes, no,
Hello.
maybe. Hello.
Yeah, I'm there.
Thank you. Thank you very much. Would you like to open the Q&A session? Maybe to share some feedback on the tools presented?
In fact, in Sri Lankan context, of course, we have produced the National Disaster Management Plan 2023 to 2030, which reflect this three most important stuff like, social inclusion. In fact, it's JC. At the same time, voluntarism and public-private partnerships. At the same time, there are 153 strategic actions. Under that, we are having the provisions for implementing anticipatory actions. At the same time, this gender-based violence prevention and all. At the same time, we are having this multi-sectorial gender-based violence prevention plan, which also cabinet approved document. So it's from 2024 to 2028. At the same time, we are having some MOU with UNFPA and implementing these sensitization programs for the subnational level officials in disaster risk management officials plus other stakeholder agencies. So basically, we are in line with all those global frameworks and actions itself. So at the moment, of course, we also find it difficult to get this, spatially mapped the database, because it is much more important for us to implement these anticipatory actions as far as these local communities who are vulnerable for such disasters. At the same time, for the free financing also, we need to have such information, otherwise there will be kind of a corruption that can happen. At the same time, as a government official, we have to accountable for the money, public money. Therefore, we are looking forward to just map, because we are having the risk index, hazard profiles, and all those information, but we need comprehensive data set on the local level for each hazards. At the same time, a lot of agencies are implementing anticipatory actions, even for you have mentioned earlier, for the landslide. Then we are doing it for the dengue from the Red Cross. At the same time, FAO is doing for agriculture impact, and the WFP is conducting this social impact itself. Likewise, there are a lot of activities happening, but as the mandated organizations, I am responsibility to, just have a kind of a one forum and go get all the information and develop a roadmap. So we are in the process of developing a roadmap to achieving these anticipatory actions. So that's from my side. Thank you.
That is great. Thank you so very much for taking the time to be with us. And it's good news hearing that the Department of Disaster Management, it's on top of their game as well. Thank you very much. We're getting to an end. I don't know if we have other questions. I apologize, we won't be able to take a lot, but maybe one or two before we end, if you have something pressing. And I will encourage the presenters as well to share their presentations if possible, and to share maybe email addresses for people to get connected with the working groups and networks. I think, Gregory, you have another question? Go ahead, please.
Yes, thank you so much, Lorena. I would like to direct my question to Ms. Sarala Fernando of UNFPA. So her actually presentation is very insightful and very informative. Just in the context as well, again in the Philippines, no, we have policies and frameworks that support the GRAA. Through there's no single dedicated framework specifically named as such. So in the LGUs, some LGUs or local government units here in the Philippines lack trained personnel and resources for gender-based violence prevention and response, and struggles to incorporate gender and social inclusion in their GBV plans. So what would be the recommendation or possible measures, or maybe a strategic direction for the Philippine government towards replicating these best practices in response to gender-based violence? Thank you.
Thanks, Gregory. So there are multiple things you can do as part of gender responsive anticipatory action, and it shouldn't just also stop at GBV safety audits. You can also, for example, one of the things that Sri Lanka does is during a disaster, we distribute kits, dignity kits and maternity kits the purpose is not just to give a kit full of items, but also to raise awareness on GBV prevention measures, referral pathways, so that people that are affected have the information to seek services. So I think that is a very basic step you can start off on if you feel like GBV safety audits as a national scale is something too big for you to start on right now, but that is definitely a first point that you can do. And yes, it also depends on how many stakeholders are involved, what kind of organizations are in the area. So yes, I don't know the country context of Philippines, but yeah, but perhaps we can have more of a chat. If you can reach out to us personally, and we can have more of a chat on this. Thank you.
Excellent. Thank you so much, Gregory and Sarala. We have which is going to be the last question. Sorry. I hope I'm pronouncing your name correctly. Mihir?
Yes, that's correct.
Perfect. Please
go
ahead.
No, I just wanted to thank for excellent series of presentations. I think, it is very timely that this discussion is initiated, both in terms of anticipatory action that is unrolling now. This will really help concretely on the ground to make a difference. And also in terms of gender, what's the agenda that we need to catch up before it's too late and we have to make advocacy. So congratulations to both the organizers and the panel members. I also found it extremely useful in terms of concrete actions that could be taken for a variety of situations, especially for urban areas. This has been very useful for our work. So again, congratulations, and I hope this continues more rapidly and without too much gap in between the sessions, so that everybody involved in this work can catch up simultaneously. Thank you very much from India.
That was very kind of you. Thank you very much for attending the workshop. And as we advised in the beginning, yes, this is the beginning of a much longer conversation. As we wrap up today's discussion, I want to extend my sincere appreciation to all the speakers, all the participants for the insights. I apologize because of some technical issues. We got a bit tight with the time. Let's keep in mind that strengthening gender responsive disaster risk reduction and anticipatory action, it's a collective effort. And this kind of exchange of knowledge and experience today is a step forward in ensuring inclusive and effective preparedness and response. Let's continue this important conversation within GIHA and the Gender Stakeholders Group to drive meaningful change. Thank you very, very much for your participation and looking forward to more collaboration in the future. Thank you. Bye-bye. Have a good day.
Thank you very much. Bye.
Bye.
Thank you very much. Bye-bye.